So tonight, what are we going to talk about? Well, we're going to talk about social connection. And the reason that I'm sharing this is because it's something that I've been developing myself, and it's something that patients do a lot of for a distraction technique. But it's more than a distraction technique. It's actually something that we do and have done for thousands of years. And in fact, since the dawning of mankind, we have been together as communities. And if we function in communities, that could be like in a social environment like a church, or it could be a smaller unit like a family home, or just a one-to-one connection with individuals, then we're really sharing ourselves, and we're connecting with other people. And for a chronic pain perspective, it's really good to have that, because there's nothing worse than being isolated at home in chronic pain, where your mind goes a little bit crazy. Those thoughts are procrastinating all the time, ruminating all the time. These feelings of hopelessness and helplessness, which is so common. And these are the types of things I assess my patients every day. Is what are they thinking? And one of the biggest battles is getting people away from that isolation and into a situation where they feel connection with people. So, this past week I had about 3 different coffee shop connections with people on the same day, and it just so happened that way. One friend, we were talking about how to develop ways of public speaking and how that could be helpful in a new and interesting way. Another was an older gentleman who's got lots of life experience with chronic pain, who's come through a lot, and I just sat down with an hour with him over coffee, and we had a conversation, and there was a connection with my heart with his stories, and I could relate to many things that he was sharing. Another one was a new friend, and we just had fun. We had a bite to eat, and it was really good. Just a connection. So I'd like to ask you that, who are you hanging out with? Which friends are you spending time with? Are you making a point of going out and making that conversation? It could be on the phone, could be on Zoom, could be on social media, but nothing better than connecting in person. I think it's good that we go out and literally create this reality. And the reason for this is something that came home to me in a workshop that I did recently around the HeartMath solution principles, which is all about heart-brain connections. Because when we are in synchrony with our heart rate and our brain, which happens when we're slow breathing, simple as breathe in for 5 seconds and out through your mouth. When we're doing this, what happens is we get coherence, which is a technical term for connection from your brain to your heart. And in that moment, there are literally waves, sinusoidal electrical waves in the heart, which are measured by an ECG, but also brain waves that can be assessed by an EEG. And it shows that when the heart and the brain are connected, we literally, not only are we slowing down our breath rate, but our heart rate, and all those parasympathetic pulses from our brain to our body starts to kick in, and that's the relaxation response. It helps reduce tension in muscles. It helps increase blood flow in the body and where you're sore. It also reduces your heart rate, and because of the breath rate is down. And there's a coherence. There's literally a connection to the vagal nerve. That's the big nerve that goes to the abdomen and the heart and the lungs from your brain, and it basically has got signals all the way up to your brain, and therefore connecting the heart and the brain. And this is what happens when we connect with people. This is why we should have good friends and good conversation and good food and maybe good wine or whatever brings you joy. One little tip: don't talk about your pain, because that stresses your brain out and causes incoherence, but talk about things you love to talk about. Listen to the person with not only your ears, but your heart. Give them a space to talk. And it's a beautiful thing because then you feel connected. And that heart-brain coherence is happening. And it's a wonderful antidote to that pain response. Wonderful treatment for chronic pain. So that's my message today. Connect with somebody and listen. See what they've got to say. Maybe something you can learn from them. Give them the space. And I think in this world of social media and busy lives, it's an invaluable quality that we need to get back to, like our ancestors have done since the dawning of time. So that's my message. I hope you enjoyed it. I hope you go ahead and do this. Please leave a comment today. Maybe you're going to go and do this tonight or tomorrow or next week or the weekend. Leave a comment. Get back to me later in the week. Tell me how it was. How was that heart connection? How did it make you feel? And also, how was your pain when you were talking to that person? I bet there was less awareness of your pain because you had something better to do. So leave a comment. Give me some feedback on this talk. Did you like it? You want more of this sort of stuff? Why not share some of the challenges that you're having with chronic pain? Maybe it's the struggle with medications. Maybe the struggle with connecting with your doctor. Maybe it's struggle with, connecting with family members. Leave a question. I've always got something to say about this, on this subject. And the more you ask, the more ideas I get, the better this live stream will get. So I'm just going to leave now. I really appreciate you listening. I thank you for joining me, because this is what this live streaming is about. It is about connection, and it's about helping us master pain, becoming masters of our body, masters of our physiology, masters of our mind, and therefore conquering chronic pain. So thanks so much, and we'll see you next week.